with reference to the question on housing. So we'll now go to the next question. The member for Barker again.
My question is to the Minister for Health. Minister, can you update the House on the action the Turnbull government is taking to invest in health of South Australians, particularly within my electorate of Barker? And Minister, are you aware of any alternative approaches that will undermine patient outcomes across South Australia?
The Minister for Health.
Thank you very much, Mr Speaker. And I want to thank the member for Barker, who's been a passionate advocate for mental health services within his electorate, within Barker, and in particular in towns that have a real need for greater support. We're delivering $30 million over the next 2 years in mental health and suicide prevention support in rural and regional South Australia, in particular in his electorate as well as in the electorate of Grey. We're also delivering just over $6 million in local drug and alcohol team support within rural and regional South Australia over the coming years, and he and others have been great advocates for that. Interestingly, what we've seen since this government came to power is an increase in Country Health SA's hospital allocation from the Commonwealth of 31.5%. What we've seen from the South Australian Labor government over that same period is an increase of approximately half of 16%. So we have delivered double the hospital funding increases over the same period as the Labor Party in South Australia. They have shortchanged their own state. Even more significantly, however, we've heard over previous days that the South Australian government could not keep the power on, could not keep the lights on in Flinders Medical Centre with catastrophic outcomes, could not keep the lights on in the Royal Adelaide Hospital. While in country South Australia, in towns such as Mount Gambier, Meningie, in Penola, what we have seen is that they also turned out the lights deliberately on their own hospitals. They shed load on South Australian rural hospitals under a South Australian government policy. This was initially denied by Tom Koutsantonis, who said they would provide continuous supply to critical infrastructure such as hospitals, only to be contradicted by the South Australian Health Department that said, quote unquote, this doesn't actually apply to country hospitals. Well, we regard country hospitals as critical. We regard country hospitals in South Australia and Victoria and in every state as fundamental to health supply. Obviously not in South Australia. So they deliberately shed load on their own rural hospitals. They failed to keep the lights on at the Flinders Medical Centre. They failed to keep the lights on and the surgery operating in Royal Adelaide Hospital. What sort of government are they running there? They are running a failed government with a failed experiment which has failed the people of South Australia. By comparison, we've seen double the funding in rural South Australia in terms of increases from us compared with our SA Labor. In the end, this mob over here are covering up for the failure of their state counterparts. We're fixing it up.
The member for McMahon.
Thanks, Mr Speaker. My question is to the Deputy Prime Minister. I refer to his previous answers. The government has so far advised first home buyers to get rich parents, or get a better job, or get out of town. Does he stand by his February statement telling first home buyers to find cheaper accommodation in Armidale? And can the Deputy Prime Minister confirm that the government's latest advice for first home buyers is to just get rich mates?
Members on both sides. Whilst the question refers to a previous statement that the minister made, they have to have a connection in some way. Just because a minister makes a statement about their previous portfolio, I'm quite uncomfortable that there's a presumption that statement can be relied upon to essentially question the minister as if he was in that portfolio still. So whilst I allowed the last question, can I just say with all candour, this is getting a little too cute. Practice is something that evolves, and it's about to evolve. I don't regard that as being in